Everyone get in. Actually, it's 7 on the dot. All right. So let's start. So just before we begin, thank you for everyone coming tonight. Um, so again, this is Amanda. I'm on Christina's Zoom, of course. And tonight we're going to talk about micronutrients. Gianna is also going to jump in and help with presenting this information. I do want to give you guys a heads up in advance that I got a little excited making this presentation just because there's so many vitamins and minerals and nutrients to go over in this that I'm gonna go through some parts kind of quickly, but in lieu of everyone's time, but we may go over as usual, I know. But with that being said, out of respect for everybody's time, this is being recorded. So the recording will be sent out ASAP as soon as I can get it to process on YouTube, along with the slides too. Just in case, and also if there's any parts that I'm going through at any moment, of course, feel free to stop me. This is an open presentation in that regard. However, I will also have a presentation question section at the very end. So without further ado, let's get started. Today we're going to talk about micronutrients, which micronutrients include vitamins, minerals, and trace elements, right? So those are more like your micro minerals, for example. I will also send out, because we have a gap week next week, the macros presentation that goes into the Mediterranean diet as well, because for many of us it might be redundant, but for many of us it might not be redundant, depending on your experience with past guided programs that we've offered. So I just want to make sure everyone's on an even playing field with that information, and to treat those recordings like a podcast if you'd like. So something just to touch base, some gentle housekeeping before we get going. We want to, oh, sorry, Gianna just was messaging me that her camera isn't cooperating. It's all good, Gianna, no worries. You can keep screen off as long as you can get the microphone working. Is your microphone working, G?
Can you hear me?
Absolutely.
Okay, good. I'm so sorry. I don't know what's going on with my camera right now. Of course, it worked last time, but all right, you'll get to look at the G instead.
It's all good. And no, that's all fine. And I think anyway, when it's recording, it might just only show the presentation slides anyway. So, all right, that's a helpful heads up. So thank you. And so just some gentle housekeeping. I want to touch base that, we set those goals individually, right? So part of this guided program is to help us in terms of self-monitoring and self-goal setting. So is we want to be recognizing different patterns. So if you're food logging during this time, right, it's about, reflecting back in your logs and noticing if there's different patterns occurring that might be, barriers or, promoters in terms of helping us to achieve those goals. If you're running into any barriers with that information or better ways of self-monitoring, of course, we are here for that. So of course we should be doing a goal check-in now at this point and saying, all right, my first week is over, so congratulations. Um, I set out to for these 1 to 3 goals as SMART goals in my overall intention that I was setting. Now, did I achieve those goals? If I was achieving it about 85% of the time, so for example, with I was saying I was trying to focus in a little bit more on like fruits and vegetable intake. So if I hit it on those like dinners that Thursday, Wednesday, Thursday nights, and it was 100%, then it's time to say, or I'm going to stay focused on consistency on that goal, or if 85%, right, want to focus on consistency in that goal and seeing if I can up the ante. Of course, we want to be checking in and learning about ourselves. That's what this whole process is about, getting to know ourselves, getting to know our bodies, our routines. And so a little helpful tip just to save ourselves time in this program too, so we're not, short order cooks with our family or feeling socially aside from what everyone else is eating, is if we could, with the recipes, check in with our family members before we go grocery shopping early in the week, seeing what they like, what they don't like of the different recipes, and then of course asking, if we want to tweak things a little bit. And if you guys need any assistance there, of course, please reach out. I am going through emails tonight. I did get some responses back with that email goal check-in that we individually sent out to everybody. So if there's some information that you want us to know, of course, on an individual basis, please send us that information one-on-one to keep, if it's a private question. But if it's something that you think the group would benefit from, of course, ask it tonight or put it in the group chat. That's never an issue. But is anybody having any struggles or questions, even just getting into practice better before we get into more of the micronutrients section of the presentation? Ooh, all right. So I'm going to take
No,
that. Oh, what's up? Can you hear me? Oh, I can.
I was just responding by saying no.
Oh, thank you. Thank you. Sorry, guys. I feel like I'm kind of piloting a little blind right now because I have it on screen share and then I can't see the Zoom. So I'm solely reliant on voices right now. So I totally appreciate that. Um, but of course, let us know if there's anything coming up. That's never a problem. So our overview for today is we're going to go into vitamins and then we'll go into minerals. We'll go into different interactions between various vitamins and minerals. And then, of course, like how to realistically incorporate those options. So, Gianna, I'll let you take it away.
Thank you, thank you. Sorry, everyone, again about my camera. You all do not get to see my lovely face, unfortunately. I'm kidding. But I'll just be speaking through the microphone. All right. So first, we're going to just quickly break down macronutrients versus micronutrients. These are very easy to remember because what they mean is in their name. The macronutrients, it's the big three, but also plus water. And these are essentially nutrients that our body needs in large amounts or macro amounts. That's why they're called macronutrients, because we need them more than the micronutrients. And the most important thing here is that these three guys, they provide our energy just for everyday life. And the main building blocks for protein, carbs, and fats are amino acids for protein, the simple sugars or the mono and disaccharides. You heard glucose, fructose, all of those build up our more complex carbs, and then fatty acids, which help build up our fats. Now, as for the micronutrients, hence the name, this means that we need them in smaller or micro amounts. And these are going to be things like our vitamins, our minerals, and our trace elements. They are still absolutely essential to be consumed every day, and they are needed for maintaining normal health, preventing various diseases, but these do not provide energy. These guys, I think of them more so as the helper or the assistant to all the different physiological mechanisms and processes in our bodies. They help make the energy, or they may help break down the energy or other processes, but they aren't actually one of the ingredients, you could say, in our energy itself. Go to the next slide. So now the key distinction from the three, first we'll look at vitamins. So vitamins are organic, which means that they have carbon in them. They're carbon based. And they are also natural substances, like I was saying before, that our body really needs to function properly. These are essential. We need them every day. Like I was saying, there are multiple biochemical processes in the body. And they are essential and non-caloric because they are required in very, very small amounts, these little vitamins. And they are very, depending on if they are water soluble or fat soluble, they can be very sensitive to heat, light, and air. For example, vitamin C, which is a water soluble vitamin, can degrade when it's exposed to too much heat, which is why we say, you can lose that vitamin C when it's cooked on high heat for too long. And their main functions in the body, like I was saying again, is that energy production. They sort of are the assistants or the helpers, regulating metabolism, and just our overall function. Go to the next one. Now, again, for vitamins, there are about 13 in the body total, or 13 that the body needs, and each one serves a different purpose for our body and contributes differently, which is why we need them all in our diet every day, and why it can feel, I'm sure, a little overwhelming, especially if you look at this graph or you look at the list of all the vitamins here on the left. You can see there's so many, they're all in so many different foods. How can I remember which ones are in what they do, what's going to happen if I don't get enough? I can imagine I felt the same way even in school learning this. It can be extremely overwhelming, but hopefully this presentation can ease some of that today. You can go to the next one. So now we're going to look at minerals, and minerals and trace elements are inorganic, which means that they do not have a carbon base and they come from the earth like rocks and soil. Now, minerals cannot be destroyed by cooking or processing. They will stay stable, excuse me. So for example, like I was saying before about the vitamin C, this is opposite. Calcium in spinach will remain intact no matter how you cook it. And I bet you may not have even realized calcium, a good source of calcium is those leafy greens like spinach. So their main function, again, in the body, kind of similar to what I was saying about vitamins. They build our bones and teeth, think phosphorus, calcium, magnesium. They are enzymes and they maintain fluid balance in the body. So these guys are all sort of like the assistants that keep the body up and running every day. And then minerals, as a micronutrient, is broken down even further into major or trace minerals. Same idea with the names. The major ones we need more of and are more important for our body than the trace ones. All right, you can go to the next one. So now for our minerals, like I was saying, there are hundreds of minerals. They can, excuse me, they're usually classified as either major or trace, like I was saying. And like I was saying, although the needs may differ between them, they are generally required in larger amounts. So some examples of our major minerals, like I was saying, include calcium, phosphorus, potassium, sulfur, sodium, chloride, magnesium. Many of these I'm sure you may be familiar with. And our trace minerals, although like I was saying, equally important, the body just doesn't need as much of them to function properly. And that includes all our other ones. So we've got iron, zinc, copper, chloride, lithium, manganese, iodine, and selenium. You go to the next one. So fueling our health and the power of vitamins and minerals. So sort of like I was saying before, our whole body runs on these guys sort of being our little assistants to an extent. So why that's important? Well, we boost our energy. They're helping that energy production, therefore fighting that fatigue, making sure we're getting enough oxygen to our tissues so they can get energy, making sure we can run smoothly every day. You're not constantly feeling that weak, tired exhaustion. They help strengthen our immune system to ward off illness. This can be things like zinc or selenium, vitamin C, iron. These ones are all really important for our immune system. So it may be good for you to specifically focus on those nutrients, especially right now in the winter time, with it being so easy to catch a cold and everyone's in these tight quarters and the cold weather. It just may be of benefit for you to focus on more vitamin C, antioxidants, those high protein foods, because they contain that zinc and that selenium and that iron, just to keep your immune system extra strong. They can support our healthy skin, hair, and bones, and they can also enhance our brain function and mental clarity. So they're hitting everything head to toe in the body. They are very important. And the key benefits of the adequate intake will help prevent multiple different nutrient deficiencies or related health conditions as a result. They can improve your overall physical performance and recovery, therefore helping your goals in the gym possibly with this program, and maintaining long-term health and vitality. To the next one. So for example, like what we were saying, those brain boosters are going to be the B vitamins and magnesium, whether the B vitamins are helping sharpen your focus, improving memory, decreasing stress, or the magnesium. It's known for helping enhance relaxation and improve sleep. I personally take magnesium for my sleep. I found that it helps a lot. As for our energy and strength, like I was saying before, we really need that oxygen to be getting to our tissues and our cells all throughout our body, because oxygen is how our bodies on that biochemical level fuel themselves to get energy, or that ATP. And iron is our transporter for oxygen in the red blood cells. Hence why I was saying before, we really need that iron, those protein-rich foods, or some of the plant-based sources that are still rich in iron. Then again, we need
Sorry, guys. Sorry. I don't know what's
it's completely fine.
All right, there we go. Hold on. Canva went back. There we go.
You good?
Yeah, sorry. Thank you.
Excellent, no problem. Calcium and vitamin D, building those strong bones and our muscles, keeping you moving, preventing the risk of fractures and injury. And then, like I was saying before, that vitamin C and zinc for our immune system. Keep going. Okay, and now just for stepping back a bit for the major reasons why these are so important for us every day. Your heart and vitality, living your life. Potassium helps regulate our blood pressure and it helps support your heart health. One of its main functions in the body is muscle contraction, regulating that muscle contraction. And one of the main muscles that it does this for is your heart, that cardiac muscular contraction. So, potassium is a number that we really like to keep within its lab reference range as perfectly as we can because it is so important for proper functioning and for life. And then vitamin E is protects your cells. It's an antioxidant, protects them from damage, keeping youthful look and vitality. Like we were saying before, vitamin E is a really important antioxidant. And why it can feel life changing when you really start to incorporate more fruits and vegetables, getting these things in, is that you feel so much more energized and performing at your best. They can assist in your hormone health, correcting any imbalances. Like we were saying, you'll stay strong against illness and stress. You'll have a strong immune system and you'll have a strong body and mind to handle these things. And you're nourishing your body to not just survive and get through life, but to live your life easier and thrive in it. And so for your challenge, think of food as fuel, choosing nutrient-packed meals and snacks, not so much of a focus on, let me get this amount of calories exactly, or do this to change the way I look here, but thinking of that food as your fuel for living your most successful and best life. And these small daily changes that are going to lead to these big long-term rewards. You know, anything that's really worth it isn't going to be easy. And taking these changes, keep them small, one at a time, and just stack up these habits over time, and it really will help long term. All right, you can go to the next one. Back to you.
All right, guys, this is where I'm gonna get a little into the weeds. I'm gonna go a little quick just in also I want to be very considerate to everybody too, because I know for dietitians this can seem like super exciting. It might be really exciting to you, but I also just want to be considerate of everybody because I don't want this to be dry, but I want this to be informative, and I hope that everyone walks away with some different information. So I have a compilation of slides coming up ahead, right? And it's each of the vitamins going through what they are, what they do, their food sources, a little information about toxicity, and a little information about deficiency. And then the end, we're going to talk more about like those interactions, like I said, and also ways to measure them. So I'm just giving everybody a heads up. Again, everyone will get these slides. So I am going to go quickly because did put a lot of work and time into these. There's 76 slides just to give everyone a heads up. So we don't expect to go through each of these a minute per slide. So vitamin A is a fat soluble vitamin, exactly like what Gianna was saying. We have our fat soluble vitamins, which is vitamins A, D, E, and K. So because they're fat soluble, they're more likely to pool in the body. Vitamin A is needed for normal cell structure and functioning of cells, especially in the skin and body lining, including the lungs, right? It helps to build up our immune system to work effectively and fight diseases, including infections. It keeps our skin healthy. So often if someone has deficiency, it can look a little almost like eczema on the skin. Many people do have different SNPs, which stand for single nucleotide polymorphisms, which is what makes our DNA different, makes us unique from each other, that some individuals may have just a harder time absorbing vitamin A as one of those options. Vitamin A is super important for young children in terms of supporting reproductive, well, supports reproduction for us in adulthood, but also growth in children and vision. So often just an interesting fact is when there's extreme vitamin A deficiency, they've created what's called golden rice or sweet potato farming in different areas that malnutrition is extremely common, that you'll see young children with what's called night blindness, and it truly gives them the ability to see again. So this is why nutrition can be so powerful, especially in certain areas of the world. It's found in two forms, retinol in foods from animal sources and carotenoids, which is the most abundant form that you'll see, which is essentially beta carotene. So our foods give us, our nutrients give it our foods color, right? So I'm going to go a little more in depth here just as I'm setting the stage. So when I'm talking about our foods, our nutrients give our foods color, right? If you ever watch Produce Pete, I think he's on like CBS or NBC on Sunday mornings. This man will teach you how to pick out produce like no other person. He's like in his 80s, he's been doing this his whole life. Produce Pete, this is a plug for him. But with the vitamin A and including vitamin E, for example, when you have pasture raised eggs, I'm trying to enunciate. There's pasteurized and then there's pasture raised. When a chicken is pasture raised, their eggs are going to have a yolk that is a deep orange horizon color because those yolks are much higher in vitamin A and vitamin E versus like those dull Eggland's Best eggs. I'm not trying to be mean to Eggland's Best. Those eggs are just more um, those chickens are fed more like corn or soy, so it's not as nutrient rich of a diet. So therefore, you're not going to see that abundance of color in the yolk. So of course, your vitamin A foods are like carrots, sweet potato, mango, milk even has vitamin A in it as well. And typically, they're going to be more orangey colored or red colored foods. The vitamin A, I guess my image got cut out of the deficiency symptoms. But like I was saying, in developing countries where there's vitamin A deficiency, you're going to see that more. Fat soluble, fat malabsorptive conditions. So if someone has like celiac disease or Crohn's disease, different digestive diseases, that makes it harder to absorb fat. If you have a hard time digesting and absorbing fat, you're likely going to have a hard time digesting and absorbing fat soluble vitamins, right? So limited intake of foods like liver, carrots, leafy greens. You're going to see a lot of common denominators like leafy greens throughout this presentation. And again, dry, rough skin, night blindness, Bitot spots, which are like these white spots in the conjunctiva of the eyes, increased risk for infection due to reduced immune function, are all symptoms of too little or deficiency of vitamin A. Too much, it can get stored in the liver. Same with like vitamin D, your fat soluble vitamins. That's a common theme we're going to see tonight. Consuming too much vitamin A while being pregnant or over supplementing, for example, can lead to birth defects. So that's why it's always important to go over any supplements with a healthcare provider, especially dietitians specifically. Of course, I'm biased being a dietitian, but vitamins and minerals is really the dietitian's domain. We get the most education in it. Most medical providers, I love them. I respect doctors, but as my cousin said, he was not required to take a single nutrition class at Yale Med School. So symptoms can include nausea, vomiting, dizziness, headache, and blurred vision. So notice too little, blindness, too much, blurred vision. So it's just an interesting spectrum to see with vitamin A. And of course, you can measure this through the blood to see if someone has toxicity. So a B complex, I'm not going to go into all the Bs. I'm going to sail through most of the Bs coming up, guys. I'm going to be very honest in lieu of everyone's time and attention spans too. So there's 8 essential water-soluble vitamins, as Gianna said. We have B1, which is thiamine, B2, which is riboflavin, B3 is niacin, B5 is pantothenic acid, B6, pyroxidine, B7, biotin, B9 is folate, and B12 is cobalamin. Originally, when vitamins were first being discovered, they thought they were all individual vitamins at first, and then they realized that it's called B complex because they all share similar roles in energy metabolism, but they just vary in terms of their distinct function. However, they're all a part of one vitamin per se. So if you're deficient in one B vitamin, it may affect the absorption of other B vitamins. So it's warranted to look deeper at times if there is further deficiency. A B vitamin deficiency can look like a deficiency in energy production because B vitamins are responsible for helping us with metabolism. Think like Krebs cycle, think your electron transport chain. You need different B vitamins to help extract energy from carbs, fats, and proteins. So if we don't have those B vitamins, our metabolism is quite literally running on three wheels of a car. So brain health, it supports neurotransmitter function. It's building blocks for different neurotransmitters, red blood cell formation, especially folate, DNA synthesis and repair. B12 and folate play a large role in that as well. So I'll highlight a few of the B vitamins down the road, but if we don't have one, like I said, they work in tandem together that you could be deficient in another. Often we screen for folate and B12. Those are the common ones. And if you usually see deficiencies there, then it's worth it to look into others or to just supplement with a B complex. Common symptoms are fatigue and weakness, especially with B1, 2, and 3, anemia, skin issues like cracked lips, like a chelosis. You'll almost see like in the sides of someone's lips, it looks like a dryness and it starts going down on an angle towards their chin. That can be a sign of B vitamin deficiency, or could also be hydration, just really cracked lips. But it's, something just to note. Your dietitian, when I work with people, I'm looking at them as they're talking. I'm looking at their skin, their hair, their eyes, on top of course, talking to them about their symptoms. But there are different physical findings when it comes to nutrition. Cognitive issues, mood changes, especially in deficiency, because those B vitamins help to make different neurotransmitters. So as you can see below, there's different sources of your B vitamins. It is a lot of animal-based foods, especially for B12. So people who are vegan, it may be worthwhile, not maybe, it is worthwhile to supplement with B12, for example. But of course, we want to eat a large variety of foods for this reason. So thiamine, you could see here. I'm going to go through these slides quickly. You could always refer to them versus me just reading off, these are the food sources, etc. I will highlight though, if someone is an alcoholic, it does inhibit an enzyme in our liver to be able to actually absorb thiamine. So that's why often in the hospital, alcoholics are often supplemented with thiamine. So that's always just an interesting fact to know. Deficiency is beriberi. Thank God in this country, we are very fortunate. We do not see a lot of beriberi anymore. Um, Functions of thiamine, of course, are right here. I'm going to just go through though. I really am going to stop in terms of the B complexes at niacin, folate, and B12. So niacin is important for releasing energy from food, like I was mentioning in terms of our metabolism. And niacin is also needed for normal functioning of our nervous system and can be found in foods like meats, wheat, maize flour, or like a corn type flour, eggs, dairy products, and yeast, like nutritional yeast, especially for those who are vegan. Now, too much or too little deficiency in niacin can lead to pellagra. So that's often, that's what that beautiful picture there on the right depicts, of course. Dermatitis, dementia, diarrhea can also include symptoms of pellagra. Causes of niacin excess in this country is normally due to supplementation or overconsumption of fortified foods, especially in children that have, food jags, or people that go on food jags that will eat the same thing over and over and over again. And this is why variety is always highlighted in terms of a good nutrition plan. So high doses of niacin will often be prescribed for people who might be trying to avoid, statins, right? But you really do want to monitor for niacin excess, which can lead to like skin flushing feeling, because niacin blocks an enzyme in the liver that produces cholesterol. So there's nothing you can go, oh, not nothing. You can go over in terms of your most B vitamins because they're water soluble, so they're not pooling in different tissues of the body. But it can be extremely uncomfortable if someone's experiencing flushing. Now, every body is a different body, right? So there's the RDA, or not RDA, the tolerable upper limit, which is considered the maximum amount that a person should consume, is 35. However, up here you see usually greater than 2,000 milligrams per day for cholesterol management. Now, some people, like a 300 or 250-pound man, 35, going above 35 might not really bother them that much. They might not get flushing. But if you have a 100-pound person, it might really bother them. So it can be dose dependent based on the individual and should always be under the guise of a healthcare professional if trying to do high doses of niacin for cholesterol management. But again, always with the guise of a healthcare provider and looking at the big picture of what's going on in the person. Skin flushing, so that's warm, itchy sensation, especially in the face, neck, or chest. I see a lot of supplements that, yeah, there is many supplements going over 100% for the bees because you often urinate a lot of the excess out. However, when you're seeing like 500% the recommended daily allowance, that should give a red flag when you're looking at supplementation in that percent daily value section on the right hand side of the nutrition facts. And if it's chronically high, so someone's doing this for years and years and years, it's not just like an acute treatment plan for 3 months. It can affect liver damage, right? It can cause liver damage, gastrointestinal issues from that flushing, insulin resistance, and gout. So vitamins are nothing to mess around with if used irresponsibly. B12 is another heavy hitter that you see a lot of deficiency for now. Not now like that we're all deficient in this country. I'm just saying that it's one of the more common deficiencies. So B12 is needed for the formation of red blood cells, right? Anemia is very common, and normal functioning of the nervous system. B12 also helps to release energy from food, similar to other B vitamins, as it's part of a complex. B12 is exclusively in animal products. Plant products do not provide very much B12 at all. It's found in meat, fish, cheese, eggs, yeast extract, so that's where people can get some. And then our country also fortifies it into breakfast cereals. So a deficiency in B vitamin, a B12 can lead to pernicious anemia, which is different from macrocytic anemia. We'll go into that. It can lead to some neurological problems. However, deficiency with B12 is more rare in those who do eat meat. It's more common in those who follow a vegan or vegetarian diet. So I did put the RDA, which stands for recommended a daily allowance. So you want to try to reach at least 2.4 UGRD, which is the RDA. So nutritional yeast can also help to enhance that. Fortified plant milks, fortified veggie burgers can also help to enhance this, and it's easily tested in the blood. Folate, on the other hand, is also an interesting B vitamin to highlight. It's also called folic acid when it's in the, I call it more premature form. So folate is important for the formation of healthy red blood cells. It's needed in the nervous system as well, like all these B vitamins. It can reduce risk for neural tube defects. So I think around 1990, our country started to fortify foods with folic acid, not folate. So this really helped to significantly reduce neural tube defects, like spina bifida. However, those with MTHFR, myself included, it's a genetic SNP, so it's single nucleotide polymorphism. You can test for that. We do test for that also at functional nutrition if we're suspecting it with different individuals. You can also ask your dietitian or doctor to test for that, nurse practitioner, PA, healthcare provider in general. So those with MTHFR should really avoid overconsumption of fortified foods with folic acid, especially if they're lacking a methylated B vitamin. And it will say methylated right there on the vitamin itself. It says it right, like methylated B complex. And what it means by methylated, it's converted already from folic acid to folate, because those of us with MTHFR are lacking that MTHFR enzyme to properly convert it over. So that folic acid can build up in the body. And instead of converting over to folate and then, being used in the various ways, like we said, neurological functioning, red blood cell formation, etc., that folic acid can pool in the body and turn into homocysteine. And that's why we often test for homocysteine when we work one-on-one with individuals, because if that pools up, it can increase risk for heart disease. Vitamins are important to look into. So different food-based forms that are not pre-fortified that you're getting folate from include leafy green vegetables. You're going to see a common theme with leafy greens. So you wonder why dietitians are a broken record when it comes to eating your leafy green vegetables. This is why. Brown rice, peas, oranges, and bananas, to name a few. So like I said, deficiency in folate can lead to anemia, specifically what's called megaloblastic anemia. Symptoms can include insomnia, depression, forgetfulness. Those are some uncommon symptoms of anemia that people don't often think about. Blood indicators for folate deficiency versus iron deficiency is you'll see a low serum folate or a high homocysteine. Iron deficiency, you see low hemoglobin, low ferritin, low serum iron. So anemia is very individualized, and there's a lot of different tests, not just on this slide, that are looked at as well. Types of anemia. So folate is called megaloblastic anemia because it's large, think mega, immature red blood cells. They're immature because they're lacking the vitamin to mature them. And then iron is iron deficiency anemia, very simple. And they're small, pale red blood cells. They're not able to really absorb that oxygen and transport that oxygen around the body. So common symptoms of folate deficiency versus iron deficiency. Folate and iron, both you'll see fatigue, weakness, pale skin. However, like I was saying, B vitamins, you see some mouth sores go on or cognitive issues go on, where with iron, you see more like dizziness, brittle nails, and pica is just like cravings for some weird food items because the body's trying to get iron in different ways. Sometimes if I see dogs licking metal, it makes me question iron sometimes, for example. So functions of vitamin C. It's a powerful antioxidant, right? So we're always trying to combat oxidative damage, free radical damage in the body, which is what contributes in part to aging and different health conditions. So it is an antioxidant. Helps in with our helping to it helps really to build up our collagen and keeps our joints strong, in combination with zinc and having enough protein or collagen in the body from diet. It helps to increase iron absorption, helps us to mature red blood cells, promotes wound healing, stimulates the immune system, so helps your body to activate leukocytes, which help to combat different pathogens and illnesses, reduces the risk of cataract formation. Vitamin C is also called ascorbic acid. So when you see it in the ingredient section of different, like the Ultima electrolyte powder, for example, ascorbic acid just means vitamin C. It's needed to make collagen, like I had said, different cartilage and bones. It interacts as an antioxidant in the body to combat that damage. And vitamin C, there is more vitamin C in a bell pepper than an orange, although an orange is still a great source. So fresh fruits, an emphasis on fresh, because like Gianna said, the bioavailability of vitamins and minerals can go down with time differently from your other elements. So especially your citrus fruits are going to be high in vitamin C, including tomatoes. And also potatoes are high in vitamin C. Too much or too little. So I put the RDA here, which is women, you want to try to get 75 per day, men 90. Scurvy is what happens. That's why vitamin C was one of the first vitamins to be found, is sailors would go away for long periods of time. They wouldn't have a lot of fresh fruits and vegetables because they're out in the ocean. It would spoil and they would develop scurvy. Thank God in this country we do not see lots of that anymore, but it leads to abnormal collagen production. Gums become painful and swollen and spongy, and you'll see more separation in the teeth. You'll see a beautiful picture next. And overconsumption is rare. So this is what scurvy looks like, just for anyone who's curious. Overconsumption is very rare because it's also a water-soluble vitamin. So you'll notice that common theme that if you take too much vitamin C, for the most part, you pee it out. For some, it can increase risk for different issues with kidney stone formation, but typically is more helpful than harmful. Vitamin D is a hot button vitamin always, or cholecalciferol. Vitamin D is needed for the absorption of calcium. So for those of us who are doing a lot of awesome strength training and bone building, but strength training to build bones, if we're vitamin D deficient, we're not wasting our time, but we're not getting the full potential out of the work that we're already putting in to go towards building our bones too. So with vitamin D, it also helps immune function, as we've learned, especially throughout the pandemic, and can help improve muscular strength. It does also help with like different hormone issues and thyroid issues, helping as building blocks for different hormones. And vitamin D is found in the diet, very small amounts, but it is found in the diet in like fish liver oils, oily fish, egg yolk, butter, very fatty things, right? However, you're going to get most of it from the sun. It does not count if it comes through a window, unfortunately. I used to think when I was driving, at least I was getting some vitamin D. Just kidding, I'm not. And ideally, you want to be outside between, say, the hours of like 11 and 2 when the sun is at its peak, especially in the summer, with as much skin exposure, well, skin showing, sound not to sound funny, as possible to absorb that vitamin D. So part of why we're at risk, it's very rare. I've only seen one person with very high vitamin D. It's extremely rare. But with vitamin D deficiency, it's super common because if you're listening here in New York, our latitude and longitude does not help us in terms of when the Earth is rotating around the sun, especially this time of year. We're not getting a lot of those direct ultraviolet rays. Some people have different SNPs, like I said, single nucleotide polymorphisms that just make it harder for our body to absorb it. Maybe we're from different areas of the world that maybe our ancestors, needed less, we're out in the sun more. You came from an area in the world where there's different latitude and longitude with the sun. So our BMI is a big factor. So if there's more adipose or body fat tissue, it's harder to absorb vitamin D. If we have more melanin pigmentation, it's also harder to absorb more vitamin D because it's blocking, right? Maybe we came from different areas of the world that there was more sun exposure, so our bodies adapted to protect ourselves. Time of the year, like I said, and skin exposure. So certain if you tend to always wear sleeves even on the beach in the summer, for example, you might be more prone to vitamin D deficiency. um, Often providers use a cutoff of 30 milligrams per deciliter in the blood work as what's called deficiency. However, as we know, a lot of the reference ranges for our blood work is based off the average individual, not necessarily the optimal functioning of the individual. So, especially a lot of research was done over the pandemic on ideal ranges for vitamin D, and especially for our immune health. You want to be above 50. I really try to get my patients 60 to 70 milligrams per deciliter in our blood, and it's typically about 1,000 IU supplement for every 10 milligrams per deciliter, you want to boost your vitamin D. However, you can take too much, and taking too much, just like any fat soluble vitamin, can cause liver toxicity. So you do want to work with a healthcare provider. In the past, when we had more deficiencies in this country, you would see if someone had very prolonged vitamin D deficiency in the form of rickets, and that's that like bowing of the legs going inward towards the knees, and soft bones because vitamin D is so essential for building bones, and it can cause a lot of muscular weakness and pain. Um, I'm a big people watcher, and I've seen it on the beach. Like I've looked around and seen rickets on the beach in older people, but yeah, it is noticeable. So, vitamin E or tocopherol. Vitamin E is also a fat soluble vitamin. It's a group of similar molecules that share common properties and functions. Vitamin E, like vitamin C, is also an antioxidant and it protects cells in the body against damage. It is also important for fertility, anti-aging effect because it's an antioxidant. Tocopherol is the most active form in the body, and typically, if someone is told to supplement, it's in that form. It's more readily absorbable. Vegetable oils, I do not recommend people have vegetable oils, so I just feel funny with it on this slide, but it is a source of vitamin E. However, I'd rather my patients get it from nuts, seeds, wheat germ, their multivitamin, right? A multivitamin is a good buffer for everybody. Deficiency and excess in vitamin D, and vitamin E. I'm so sorry. I'm so used to talking about vitamin D. Vitamin E is very rare, but because it's widely available in like nuts and seeds, for example, and our multivitamin, and it's not needed in a very high dose to get enough. Um, However, in very rare cases, their neurological disabilities such as lost reflexes can happen. Uh, Defective lipid absorption, right, or fat absorption if you're low in different fat soluble vitamins. Um, Vitamin E is helpful in terms of the maturation of red blood cells. It's not as key of a player as folate or your iron, for example, but it does play a role and it does impact sperm formation. So, in terms of fertility, vitamin E is important for male health as well. Uh, Again, though, vitamin E has a low toxicity just because there's not it's easy to get enough of, but you don't get too much of it typically in the types of foods that are in our diets. And it can interfere with absorption of vitamin A because they're both competing for a similar absorptive pathway because they're both fat soluble. Vitamin K is very interesting in that it's needed for normal clotting in the blood and it's needed to help bone structure. So that's why you'll often see vitamin D paired with vitamin K because the vitamin K helps the vitamin D get shuttled more into the bone for bone health. Infants are often given, they are often, they are given vitamin K at birth because they don't really have a microbiome. They're as sterile as you get in terms of pathogens and bacteria. Their first real exposure to that is if they are a vaginal birth, but if they're a C-section, they're not really getting that bacteria as much. So vitamin K is produced by the bacteria in the gut, and this is important for blood clotting. However, those on those old school blood thinners like a warfarin or a Coumadin are often getting their vitamin K checked, along with other factors, because they want to keep their vitamin K consistent so that the medication can be dosed appropriately. If vitamin K is going up or down, that medication needs to be updated. But you're not seeing warfarin and Coumadin as much anymore. There's been other drugs created that kind of bypass this pathway. Vitamin K, yes, again, leafy green vegetables, broccoli, lettuce, cabbage, spinach, meat, and dairy products will also contain vitamin K. Minerals. So now we're getting into the mineral section. Like Gianna beautifully described, they're inorganic substances needed in the body for different functions, and they're needed in smaller amounts than vitamins. There are more like macro minerals and trace elements or trace minerals, such as fluoride. So in general, high mineral foods can be whole wheat bread, mussels, oysters are a powerhouse. Oysters are the highest natural source of zinc. They are amazing for you. You just want to get them from a little further out in the ocean, not as close inland where there's pollutants, because they are on the bottom of the ocean where different debris, settle. Salmon, oatmeal, liver, ribeye steak, just to name a few high mineral foods. Liver is a big uh, powerhouse. So macro minerals, meaning that you need greater than 100 milligrams per day. Micro minerals, meaning you need less than 100 milligrams per day. Calcium, phosphorus, sodium, potassium, chloride, and magnesium are your more heavy hitters. The rest are needed in much smaller amounts. So calcium is important, as we know, for bone formation and maintenance, especially for our teeth. So that's why you sometimes see women when they have a high need for calcium, especially, maybe towards with breastfeeding, for example, that you might see some dental issues go on, being that their body starts to pull calcium from other areas of the body to supply that calcium for other bodily needs, as well as normal functioning of the immune system and muscles because it is an electrolyte too. It helps with electrical signaling in the body. It's also involved in blood clotting, and we need 1,000 milligrams per day for the average person. Milk and dairy products are the largest, I don't want to say most important, but the largest sources of calcium. And other sources can include bread, enriched calcium, soya products, leafy green vegetables, especially fish. It's emphasis on fish with bones, though. I'm going to be very honest with everybody, so I know that's not the easiest to get down. Like I said, soft edible bones. So, calcium supplementation as we get older, especially post-menopause, is something that people do start to consider, but it needs to also be done in conjunction with looking at your heart risk as well and your different like calcium score, for example. So too much or too little, poor intakes of calcium can lead to poor bone health. which can increase risk for different diseases like osteoporosis later in life. It's important while you're younger to get a lot of calcium so that it is getting absorbed into our bones. Taking high doses of calcium supplements can sometimes cause stomach aches, diarrhea also, and we want to make sure that calcium is going into the bone and not so much the circulatory system and causing calcification there. Calcium is very cool because for a micronutrient, it takes up about 1 to 2% of our total weight. So it's one of the heaviest nutrients in the body. For an average adult weighing 70 kilograms or about 154 pounds, it translates to about like 1,000 to 1,500 grams or 1 to 1.2 kilograms of calcium in the body. Most of it is stored in the bones and teeth, like I said, but that 1% is in the blood, muscles, and other cells. So this is why when you're measuring calcium in your bloodstream, it is not an accurate depiction of your calcium status. So someone could have a lot of calcium or high calcium in their blood for different kidney reasons, or it could also be a sign of deficiency that the body is starting to pull it from the bone to use for these other functioning. So it always means to dive deeper, and we'll get more into testing. But with calcium, you utilize a DEXA scale or DEXA scan to look at how much bone you have, and how much bone you have can tell you about your calcium status, but also doing what's called a 24-hour recall and looking at, your typical dietary intake. Iron is another heavy hitter. Iron deficiency is the most common deficiency in this country. Iron is needed for the formation of hemoglobin in red blood cells. So to help our body to breathe and get oxygen to our tissues is more so what I should say, and oxygenate the body along with, of course, our lungs and circulatory system. It's required for energy metabolism and has an important role in the immune system. And a lot of individuals who are trying to lose weight or decrease body fat, increase muscle, our body, we will not lose weight if we are anemic very often. So that's why if you're struggling, this is something really, interesting to look into. Could I possibly have anemia, or do I need to resolve my anemia to go forward with my other goals, right? So fatigue, reduced physical activity levels, can contribute to that decreased ability for weight loss. It might not be as easy to exercise if we can't get oxygen to our tissues, right? Slower metabolic rate due to impaired energy production or ability to exercise, right? Build muscle. Increased cravings for different energy dense foods, because sometimes with iron deficiency, there's that pica, those different cravings. Hormonal disruptions affecting appetite, like our thyroid functioning and our leptin functioning, just to name two hormones that can be disrupted with anemia. There's different forms of iron. There's heme and non-heme iron. So so iron is more easily absorbable if you get it from meat, unfortunately or fortunately, whatever way we want to interpret that. Non-heme iron is present in plant sources. So it's still a great source of iron, but it's just not as bioavailable or absorbable as heme iron. So beans, nuts, dried fruits, whole grains, soybeans, soybean flour, dark green leafy vegetables, again, makes an appearance, are other great sources of iron. So it may be important to look into definitely testing iron if someone is vegan or vegetarian. If someone has a lot of heavy bleeding, it's important to test iron, or different digestive issues. It's important to test iron. But your basic CBC metabolic panel that you get done with your provider does always kind of do a general scan for iron. So this is why it's important to follow up with routine blood work annually with your providers. Like I said, I went into a lot of this. Your body stores iron as ferritin. So some people have high ferritin intake, so they might just have high storage of iron. But there are different genetic traits for a condition called hemochromatosis, which are individuals who are prone for having too much iron in their body. And they might want to call themselves an Iron Man. That's cool, but it's also not good. Iron, think of like your body like rusting, right? It leads to more oxidative damage in the body. So often those with high iron are told to, donate blood or to undergo chelosis if it's a very extreme condition. But, it's worth noting because I think it's about what is it? I think almost like 10 or 15% of the population has it. So sources and the RDA. Heme iron, like I said, animal meats, liver, again, it's another nutrient powerhouse, right? 25% absorption. Where non-heme iron, it's also because it gets bounced up in the fiber, and fiber is so great, but fiber traps nutrients and then it passes through the stool. Fiber also traps like cholesterol and sugar as well, but it can impact the absorption of certain things. So that's part of what impacts the absorption of non-heme iron, and that there's a 5% absorption with that. Women need menstruating women need a lot more iron than men just to replete what was lost in the blood that was lost. So women need about 18 milligrams per day, where men need about 8 milligrams per day. Once we enter menopause, though, that drops back down similar to the male RDA. Again, RDA stands for recommended daily allowance. In its proper balance, iron also helps to combat oxidative stress in the body, and it contributes to various antioxidant processes. But like I said, too much iron can be damaging. And so, just like anything, balance is key, yin and yang. Too much or too little, I've already gone into this. Poor concentration though. So in children too, like sometimes it's worth noting, like, could there be different deficiencies going on? Something I missed that I actually do want to make sure I state is vitamin D deficiency. In terms of depression, it's mixed results in the literature. It's like a small to moderate link. But in terms of anxiety, the last I looked into it, it was a stronger link. So sometimes, if you're experiencing different, concentration, anxiety issues, it is worth it to look into your nutrients. Too much iron in the diet can also result in constipation, nausea, vomiting. So, if you do take an iron supplement and you feel like it's really bothering you, there are other ways to go about it. There's other forms, like an iron bisglycinate is a little easier to absorb, or sometimes different supplements are formulated differently. So, if you're told you have to take this supplement and that's just it, it's worth talking to a provider or dietitian about finding the right dosage and the right form for you so that you can continue to lead your happiest, healthiest life. No one should, even though it's constipation, nausea, diarrhea, vomiting, those kind of symptoms might sound more mild, but it's not something that anyone should really be living with. Phosphorus, I'm going to sail right through, right? So phosphorus is essential for the structure of bones and teeth and cell membranes. So this is going to be one of our more like trace minerals. Potassium is also an electrolyte. It's essential for water and electrolyte balance. If our potassium is too high, we can have a heart attack. If it's too low, we could have a heart attack. So that's what's really scary about eating disorders, because often if someone has a very bad eating disorder and they're not getting enough in, you see low potassium. So for us, it's important to get enough potassium in foods from dried fruits, bananas, berry fruits, like your raspberries, for example, leafy greens, another star of the show, right? Broccoli and spinach, meats, nuts. Nuts are another star of the show when it comes to nutrients. Seeds, pulses, which are more like your beans and legumes. Potassium, another way to monitor your electrolyte balance, including your sodium, is often we're told, like, drink a ton of water, which is good. We want to drink about half our body weight in water, especially if your goals is body composition and weight alleviation. However, if you're urinating 3, 4, 5 times in a row and it's clear, you could be oversaturating your electrolytes, which can make you feel a little lethargic and you might not get as much out of your, workout. So you do want to monitor that. An average healthy individual needs about 2,300 milligrams per day of sodium. So if you're food logging, you can track all of these vitamins and minerals. Now, it gets super overwhelming even as a dietitian. So it's nice to just hone in on one thing at a time based on your own individual needs or what might be going on in your lifestyle. But what's really cool is Chronometer and Practice Better, the two softwares that we highlighted in the first presentation can go down to the micronutrient. That's why when I worked in research, we would use Chronometer because we wanted to study various micronutrients in individuals. And Chronometer is pretty exact in terms of their nutrient database. They do have a good quality assurance in terms of, in the past when MyFitnessPal first came out, anybody off the block can add food in and say it's this many calories, carbs, fats, proteins. But for something to be an approved like check mark item in Chronometer, it means it is assured to be the right content. And I'll go into more where you can get information on certain foods and what's the best sources for things and a great spot to check. But sodium is an essential micronutrient. It's present in very small amounts in raw foods, like also seafood as well. Often salt is added during the processing and preparation. You don't need me to tell you that. Um, of course, like a bacon, cheese, yeast, bread, smoked fish are high in salt, but if eating out in general, too much or too little. Too much can affect our blood pressure, of course, and is linked to increased risk for heart disease and stroke. Sodium deficiency is unlikely, but can be caused by excessive sweating. So if you're playing basketball for 60, 120 minutes, especially you see this with football players in the summer wearing heavy padding, it's super important to make sure your sodium is in balance. And if you're seeing excessive sweating, vomiting, diarrhea, it can be a sign of sodium deficiency. Now, those who are trying to regulate their blood pressure, maybe this is one of your goals, right? Potassium interacts with sodium. So they do a nice little dance with each other in the kidneys, meaning that potassium helps the kidneys to excrete more sodium through the urine. So if you're not eating enough potassium, right? Like you see individuals, like when I look at potassium in the blood, that's also my secret way of knowing if the person eats a lot of fruits or vegetables and what might be going on in their body. Um, so if you're not eating enough like high potassium rich foods, the kidneys are more likely to hold on to sodium. If you're eating more potassium, they're more likely to release sodium in the urine. So this reduces overall sodium levels in the body and is a good means for lowering blood pressure. So often we're told, keep your salt low, but I also like to think in abundance mindset and what to add mindset of, get your potassium up. Potassium helps to relax blood vessels. That's part of what makes it an electrolyte, and it can lead to vasodilation, so that widening of blood vessels, further helping to reduce blood pressure. That's part of why nitric oxide, if you see on social media, is a big talking point now, because it helps with that vasodilation. We want these big railroad track highway looking blood vessels, right? We want to be able to get nutrients to and from where they need to go with little stricture, right? Fluid balance, like I said, helps to maintain healthy fluid balance inside and outside of the cell to maintain pressure regulation within your cell. So when you see a lot of edema present in older individuals that have a lot of like ankle swelling, sometimes you're questioning fluid balance in that. So these are just cool little things that you might pick up today, but you never know where it could help later on. All right, so I don't try to be a hot button person. I try, to be very diplomatic with everybody, but we're going to talk a little bit about fluoride just because it's a common question we're getting now. So, food sources of fluoride, yes, it's in our water. That's the main source. Teas, seafood, and some fruits and vegetables, right? So we can get it other places than just the water. However, it is the main source. Deficiency of fluoride, yes, there's increased risk for dental cavities or tooth decay, weaker enamel, and potential for tooth sensitivity. And I place some sources below as well. Excess fluoride can lead to mottling or discoloration in the teeth. Mostly that's a cosmetic issue, however, but if we care about what we look like, that's cool. And it's important to care what you look like to an extent, right? It's how we present ourselves professionally sometimes. IQ reduction in children, osteosarcoma, thyroid injury, and calcification of the pineal gland in the brain, but these are with high doses of fluoride. Nutrient interactions. This is the next section that we're going to get into. Some nutrients work together in the body, completing different functions, right? So vitamins A, C, and E all can work together. Calcium, phosphorus, and fluoride, calcium, and vitamin D, iron and vitamin C, carbohydrates, and B vitamins. So we'll get a little more into that. So vitamins A, C, and E are all antioxidants, and they work together in the body to protect cells against oxidative damage from free radicals. This damage can increase the risk of developing different diseases like heart disease and cancer. So see free radicals as how to explain without the visual. They're molecules that are trying to get stable. They're missing a molecule, so they're trying to latch on to another, latch on to another, latch on to another, and it's causing mass chaos where other molecules around it start to lose different oxygen, essentially, O2. So antioxidant is meant to help replace that and restabilize the molecule, and then there's less damage in the cells. So calcium, phosphorus, and fluoride all work together. They're involved in the mineralization of teeth and bones. So of course, vitamin D also plays a large role in this, and vitamin K too, but they do work together in building strong bones. But like I just said, vitamin D and calcium are also on this slide. Next is iron and ascorbic acid, aka vitamin C. So they work together to enhance the absorption of iron. So often, if I have someone who's anemic taking a iron supplement or eating iron-rich foods, like after, a large blood work testing, we want to say, if you're going to eat steak, have some broccoli with it or some bell peppers with it. Or if you're taking your iron, you want to take that separate from a meal, separate from other nutrients or like a multivitamin because it will inhibit the absorption of that iron. You might take it with just a little swig of OJ to get it down and give a little vitamin C, or take it with a clementine to help absorb that iron. How do I know if I'm getting enough in? So many of these vitamins we can test in the blood, and often when we're working one-on-one with individuals, we try to first focus, depending on their goals, if it's weight loss or just general healthy diet, first calories, then macronutrients, then more micronutrients, right? So you would test in the blood, you could do vitamin D, B12, folate, vitamin A, vitamin C, different minerals, iron in those different forms, calcium, magnesium, potassium, zinc, and sodium you can look at in the blood. Now, often dietitians, this is why we ask everybody, what do you eat, right? It's very hard working sometimes with someone when they're like, I don't know what I eat. And it's like, I get it, every day is different. But that's why we might ask someone to keep like a general food log to kind of just get an idea of what's going in, and we know every day is different and should be, just to also get a sense of not just carbs, fats, protein, and calories, but to go this, deeper step. So the more information we have, the more we can help. Nutrient analysis software is just like Chronometer, Practice Better, I mentioned. The DEXA scan is a great way of looking at your bone health and therefore part looking at your calcium. And it should be mainstream. It should be covered by insurance, but unfortunately it's not. Vibrant testing looks at intracellular and extracellular micronutrients. So I just want to share that. So that's what this test is. We recently started offering it at Functional. And an example test looks something like this. Um, so it actually looks at your blood, and you would go to a phlebotomist for this, and we help individuals set this up. But this is just an example test, and it looks at someone, say vitamin K, their cardiovascular risk, if they're absorbing different nutrients like omega-3s, K2, different amino acids like isoleucine and leucine, cysteine, for example. But it will look into most of your major micronutrients and see if you're deficient, which is really, really helpful and nice. So see how in depth this goes, and it looks at your amino acids, not just are you getting them in, but are you absorbing them? So medicine's moving along nice. It's just getting it infiltrated into the mainstream. Insurance is a whole slow process, naturally so, because there's just a lot of checks and balances to make sure safety, efficacy, and not wasting people's time, energy, and money. Um, Next is, I just want to go back into presentation mode. Key takeaways though, honestly, we could do blood tests, DEXA scans, and nutrient analyses through the diet to get a really good picture of, what you're getting in. And it's also in compilation with your symptoms. So I'm going to toss it back to Gianna, and thank you so much for sitting through the section. I know it was a little dry. I tried to give it a little bit of spice and love, but I hope everyone took something away from going through each of those nutrients. Gianna, without further ado.
Amazing. Amanda, you are amazing as always. That was incredible. Thank you for all of your hard work into that. All right, so let's get into this. So how can I maximize my intake? You just heard all that information. Maybe now you're thinking, well, where in the world can I get all of these nutrients in one day, every day? So if you want to go to the next slide, the key here is variety. This is something I really push, not only with clients, but even with families and friends on social media platforms, is to eat the rainbow, basically. The more colors you can get, the better. I'll try to say something along the lines of, looking at your plate or looking at what you're going to prepare, you could think to yourself, how can I add at least one or two at most more colors to this meal right now? When you're preparing it or when you're thinking of it in your mind, you're about to order somewhere, just try to add at least one more color. This can be incredibly helpful because, like we were saying, each food provides different nutrients. And as you just learned, they all have different roles in the body. So the idea is to get this whole synergistic play of all of them every day in different meals in different amounts throughout the week so that you can have a body that is functioning at its best with all of these vitamins and minerals. You can go to the next one. So a key tip here is to choose fresh and seasonal produce because the nutrient density is the highest in certain produce when it's the freshest in season. So for strawberries in the summer, for example, or apples in the fall. And you want to avoid long-term storage, which can deplete certain vitamins. Like we said, vitamin C is very sensitive, we could say. It's to the heat, it's to the long-term storage. It's going to be depleted. So making sure in those vitamin C rich foods, you're getting them as soon as you can. Or if they're not in season, like it's not the summertime, excuse me, you can opt for a frozen option instead because typically these foods are going to be frozen at their peak ripeness. You go to the next one.
I definitely want you to that was so good you mentioned that though. I definitely just want to highlight that. So when it comes to berries, for example, right? Most of our berries, because a lot of us eat berries because of fiber, anthocyanin, all the nutrients we talked about, vitamin C, that most of our berries come from about California right now, like out west. So here in New York, that's a large distance to travel. So when they're flash frozen like that, exactly what Gianna said, it's peak ripeness. But when berries start to come into season, May, June, July, buy them fresh, buy them local. But if you're buying them now, I sound kind of cynical, you're going to get more nutrients in the frozen form. So I just really, really want to highlight what Gianna said. That was so well said and important.
Amazing. Okay, thank you for that. So another good tip here is the specific cooking methods that you are going to use. Like we said, vitamin C, it's a little weak and sensitive. So, boiling it and that exposure to that high temperature can cause some of the vitamins to actually leach into the water. It's a common thing with the B vitamins. That's why they're water soluble. They are very easy to lose in food. And like I said, the same with the vitamin C. So steaming, microwaving, and sauteing are going to be the best options for preserving the most nutrients you can out of the food outside of course, once it's been washed and prepared if you just ate it raw, like a bell pepper. But a little tip here, I know it's a little bit of hard bait to bite to, but with broccoli, if you microwave it versus steaming or anything, it's going to be a way to preserve the nutrients and the vitamin C in it, specifically the most. I know microwave broccoli doesn't really sound that great, but just something to keep in mind. And again, avoid overcooking. The longer they're exposed to that heat and that temperature, they're going to, like we said, leach into the water, get destroyed, lose their bioavailability. And keep going. So, like Amanda was saying, combine your nutrients for better absorption. So, those fat soluble vitamins with a fat, i.e., when you have your salads, it's okay to have the salad dressings with the fat in it. You don't always have to feel like you got to go for that balsamic vinegar because that fat is actually going to help you absorb all of the vitamins and minerals that are in that healthy salad and make it even better. Another thing is adding avocado to smoothies or maybe some sort of unsalted nut butter just to give it that extra boost. Like she said, the iron with vitamin C, such as spinach, it's citrus fruits or bell peppers, common combinations. Calcium absorption can be impaired by high amounts of oxalates and phytates. So reducing these by soaking and fermenting grains and legumes is going to be your best bet there. As for magnesium and vitamin D, magnesium is essential for its activation, and that then leads to supporting calcium absorption. So it's this sort of cycle of the magnesium helps the vitamin D helps the calcium, and then it has all of these other factors for our bone health and blood flow. And then lastly, zinc is better absorbed when it's combined with protein sources or consumed with protein sources, specifically animal proteins like meat, poultry, and fish.
I really want to highlight something Christina said. Gianna, that was awesome. Thank you. Christina told me about this brand called Jovial. So for those of you who are interested, especially with the calcium absorption concept, Jovial or has already pre-fermented beans. So if that's up your alley, it's just good to know about that.
That's awesome. Thanks for that. I didn't know that.
Yeah, right. I thought that was cool when she said that. So I was like, let's share the wealth.
Yeah, give it a little shout out. Okay, so another thing that you may hear a lot is to eat the skin. It's good, and that's true. You don't want to peel or over process your produce. The skin on the apple, the zucchini, the squash, they have lots of vitamins and minerals within it. And when we peel those or when they're overly processed, they're going to sort of lose that. So minimizing it with foods that are nutrient dense and, like we said, don't peel them, give them a good wash. If you give them good spice and flavor, some nice olive oil or avocado oil to give it some extra flavor. That can help if you're uncomfortable or don't love the texture and taste of the skin. An apple with some cinnamon, just some ways to make it more enjoyable for you if you don't really like to eat the skin, but that is really where you're going to get the fiber, especially in a lot of these vitamins. So, to consider food pairings for optimal absorption, like we said, vitamin D with calcium. So, an example is the fatty fish or fortified foods, and magnesium, like we said, with the vitamin D. So, those examples are leafy greens, nuts, seeds, and whole grains. So, those are just some examples for you guys. And then how to avoid nutrients lost from storage. Like we were saying, store them in a cool, dark place to minimize nutrient loss, especially from the light and the heat. Keep fruits like bananas and apples at room temperature, while berries and grapes should be refrigerated. And use an airtight container for storing any leftovers to reduce the oxidation and vitamin degradation. So finally, we're getting to the end. Supplementation when necessary. Like Amanda was saying, supplements can help, but we want to focus on the food first. The food is going to have much more bioavailability and absorption than the supplements. So that should be where our focus is, unless supplementation is necessary and needed. So, like I just said, fill in the gaps when necessary. Always do this with a healthcare professional, your dietitian, your primary care physician, whoever you need to work with, just to make sure that you are only taking certain supplements just to save yourself the money and stress if they're really needed. You can go to the next one. So, like we were saying in the beginning, take action today in your program. Focus on variety in your diet, focus on the colors, lean proteins, those healthy fats, eat the rainbow, use smart cooking methods to maximize their absorption, and consult with a professional if your supplementation is needed. Your health is your greatest investment long term, so start fueling your body today.
Wonderful job, Gianna. Thank you. And sorry guys if this was a little long and a little intensive, but we wanted to make sure everyone got all like really good information and we wanted to make sure it was all encompassing. Huge thank you to Gianna for awesome presentation. And I hope the main intention is that deeper understanding of our food in that it creates more of an excitement of I want to eat these foods because it provides me with all these nutrients. It's important to go deeper than just carbs, fats, protein, calories, right? Just eat the bar, right? If the macros fit kind of concept. This is why the ingredients in your food and where your food comes from makes such a difference in terms of our health, right? It goes deeper. But we want to just thank everybody for sitting in on today's presentation, especially and for attending today's presentation, first and foremost. But does anyone have any questions about the presentation or just, in general about nutrition or what's going on in the program? Oh, I see, Tamika. Good question. How long should we cook the leafy greens to keep the vitamins in them? Very good question. So you want to try to cook them almost as short as possible, right? So the more the fiber gets broken apart, that's like the cell wall, and the cell wall holds the liquid, right? The water in the cell, right? So when that water gets leached out, the vitamins inside of that gets leached out. So really, it's not like a number per se, like a hard number. That's why some people go very hardcore, like a raw diet, because it's going to have a higher nutritional value of certain water soluble nutrients. So less is best depending on what we're aiming for, if that makes sense. But I hope that helps. And does anyone have other questions? Uh, So I'm gonna send this recording out as soon as I can. And we look forward, not this week, coming up the following week, we're gonna do phytonutrients. So it's not gonna be as long as this presentation because this kind of set the foreground for phytonutrients, but we're gonna go a little bit more in depth just in terms of the colors of our produce, like anthocyanin and resveratrol, so that this presentation, this series gives you a deeper understanding of nutrition. But it's a lot to take in, a lot to absorb. But the main intention is to create that motivation and excitement behind your food, so that maybe if you turn around and you say, "I'm doing really good with my carbs, my fat, my protein, my calories, but I'm noticing the doctor told me, my bones are a little weak, right? Or I need to focus in on my blood pressure." That maybe I'm going to try to tailor my next goal towards getting enough potassium in my diet, or getting enough vitamin D in my diet, or staying consistent with my multivitamin, whatever that may be. If you have individual questions, reach out, and of course, utilize the chat as needed. But we hope everyone has a great night. And again, thank you to Gianna for helping with the presentation tonight, and thank you to you guys for sitting in.
Thank you, Amanda. You are so amazing and smart as always. This was great.
Thanks, guys. Thanks, G.
Thank you.
Thanks, guys.
Thank you. That was great. Have a good night.
Be well, Sandy. Have a good night.
You too.